Good morning, everyone. Good morning. Back here. Good morning, everyone. Derek and I wanted to start off a little bit different today, and we want to hear from a few of you about what matters to you most in your work, or what brings you joy in your work. So let me start right here. Can you tell us where you're from, your name, and what matters to you most in work?
Sure. My name is Carla Vandervoort. I'm from Canada, Ontario, actually. And yay! And what matters to me most in my work is when people are treated in an equitable manner, because I see how that impacts their overall health.
Thank you. Very important. Derek.
Good morning, everyone. I'm over here. So what matters to you? What brings you joy? And tell folks who you are.
My name's Greg Vandenberg. I'm from Appleton, Wisconsin. I definitely had joy when the Badgers won the game last night. But what brings me joy is being able to work with amazing people who have really different personalities, really different skill sets. But when you can change the course of someone's life by an intervention, a conversation, or any type of work, when you can change their life for better, that brings me joy.
Great. Thank you.
And over here, sir, can you tell us your name, where you're from, and what brings you joy in work?
Sure. I'm Dave Margolius from Cleveland, Ohio. And yeah, that's cool. And what brings me joy is similar to what the last gentleman said, which is shared purpose, which is basically everybody feeling like they are making a difference together.
Thank you.
And I have someone here who I'm going to ask the same question to.
Hi, Meryl Moss from Coastal Medical in Rhode Island, and I guess we're all saying much the same thing. I'm with a team, and we've worked really hard to develop this team, and as we get involved in this new work, you sort of have to build it from the ground up, and I think that that's the most exciting thing of all.
Thank you, Meryl.
All right, as we make our way upstage, if you will all take a minute and turn to your neighbor and share and listen about what brings them joy in their work, about what matters most in your work. Thank you.
So thank you. Thank you for sharing. So I was wondering if we could ask Trissa what matters to her in her work. Trissa, what matters to you?
Thanks, Derek. So there's a couple things that matter to me most at work. One is work-life balance. So when I was growing up, my parents taught me that you work in order to make enough money to take vacation. And I kind of bought that, right? So, I love my job, but at any point in time, if I had to choose work over vacation, I'd choose vacation, right? Work, go to Disney. Work, hike, go to the beach, play games with my family. I'd certainly choose that any day of the week. But given that, I'm lucky enough to really love my job. And when I'm at work, one of the things that matters to me most is being able to make an impact and make progress toward my mission. And you may have heard me say this before, but one of the things I'm really committed to is changing the way we practice medicine. So in addition to treating disease, we also are working together to create health, to improve the health of individuals, populations, and communities. Everyone in our communities. And I'm lucky enough to work in an environment that cultivates my ability to make an impact toward that mission. So that's what matters to me. What about you, Derek? What brings you joy in work?
Well, thank you, Trissa. One of the things that brings me joy in work is getting to work with amazing people like Trissa.
Thanks, Derek.
You're welcome. At the IHI. And Trissa has two jobs this morning. The first is to be co-presenter with me, and the second is really in response to some feedback that I got when I first stood on the summit stage 2 years ago. And someone wrote in their feedback, Mr. Feeley seemed to have some interesting things to say. But IHI should consider providing him with subtitles. And so we've gone a step, we listen to feedback at IHI, but we've gone a step beyond that, and Trissa is here not just as co-presenter, but also as translator.
So if anybody needs any help, just wave your hands or call out, and I'd be happy to translate Derek for you.
She's been accustomed to this accent. But the main thing that gives me joy in work, Trissa, to really answer your question, I think you find joy in work at the intersection, at the corner of meaningful work and quality improvement. It's about engaging people in that meaningful work that gets to improvement. That's what really creates joy and happiness at work. But there's a group of people who I think share my accent but can say it better than me. So why don't we give them that opportunity?
After free play, when the children are finished playing, we ask one of the children to shake the tambourine and all the children come to the book corner. And then we choose some children to go and tidy up certain areas within the playroom. And then the snack helper ticks on their tidy up chart which areas were tidy using smiley and sad faces. And then they come back to the book corner and tell the other children which areas were tidy, which areas weren't tidy, using smiley faces. And then we carry this over to the run time chart, putting on how many smiley faces we had.
The children can then compare today's results with what happened yesterday or the day before to see if we had more or less smiley faces, and talk about whether the line has went up or down, bringing in their numeracy and maths into it. And then all the children are given a sticker as a reward for their hard work. We're tidying up. The use of the runtime chart came from the Early Years Collaborative. It's something that they're looking at. They wanted to show that even 3-year-olds could use the chart, so that was the idea of bringing it into nursery. But then on Wednesday, when we had 5 smiley faces, how did we feel?
Happy! And that's kind of what it should feel like to work in our workforce. That's what joy should feel like, that when we see improvement, we should feel happy. And we should feel engaged. And we had a great example of that actually on Saturday. On Saturday we had our 100 Million Healthier Lives spring gathering. And amongst the folks who spoke to us were 3 students from Algoma, Wisconsin, Karina, Caden, and Quinn. And they have been learning quality improvement. And what's more, they've been teaching it to 6th graders. And to just see the joy that has instilled in them, it was quite breathtaking. So that's kind of what matters to me, Trissa. Why is this really important right now, do you think?
So I think it's really important for us to focus on joy in work now, because we have such a big job to do. We need to improve outcomes for individuals and whole populations. And finally, we need to tackle and eliminate health inequities. This is a huge lift, and I think it's going to take all of our energy to make these kind of changes. And I think we know what to do, right? We know we need to build strong teams. We need to partner across sectors. We need to have unending attention to quality and safety. We need to address the social determinants of health. We need to reallocate resources. I think we know what to do, but it's going to take all of our energy together to make these kind of changes. And unfortunately, I see so much of our energy tied up in just survival and surviving in the day-to-day adverse environments that we're in. So this is why I think it's so important now to focus on joy, because I think if we could bring joy back to our workplaces, we could release and harness that energy to drive towards the change and the improvements and the outcomes that we want to get to. So next we might ask, how big of a problem is this? How far are we away from this ideal of joy in work? Well, it's a pretty big problem. Now we know that employee satisfaction, employee engagement, and burnout are not all the same thing, but they're certainly all interrelated. And burnout is one of the factors that we can measure. And we see that provider burnout seems to be at an all-time high. Physicians, nurses, other clinicians, and even non-clinicians. And it's getting worse. When we compare to other workforces across the country, rates of burnout are relatively flat, but in our physicians, a 10% increase over a 3-year period. This is a big problem. We might even call it an epidemic. So for all of you out there, are you feeling it yourself? Are you burnt out? Do you see it in your colleagues and your staff? Show of hands, how many of you out there are getting rained on? Yeah. I think that, unfortunately, it's pretty prevalent. And we've learned from other industries that there are direct correlations between employee engagement and other business outcomes, between employee engagement and customer satisfaction, productivity, and even profit. And we suspect similar relationships occur in healthcare. And we do know within healthcare that employee satisfaction and patient satisfaction are directly linked. Worker safety and patient safety, directly related. When we're stressed and pressured, we miss things, we make mistakes, and more importantly, we have difficulty listening. So if this is our current state, how can we find the energy we need to really relate with our patients and their families and meet their needs, to build new kinds of partnerships, and to find the creativity to redesign care, which is what we need to get to our next level of outcomes. So recognizing that this is such a big problem, and perhaps even an epidemic, Derek, what can we do about it?
Thank you, Trissa. So Trissa and I rehearsed throwing this to each other. It wasn't entirely reliable by way of a process. This is what you see when you come out of the lift on the 7th floor at IHI.
Wait, I'm sorry. He just said lift. For all of you out there, that means elevator.
Okay. This is what you see when you come out of the elevator at IHI on the 7th floor. This is the very first words that anybody who visits IHI will see, that we will improve the lives of patients, the health of communities, and the joy of the healthcare workforce. And we see that at IHI as part of our mission. Part of why IHI exists is to improve health, healthcare, and to create joy. And when we talk about joy, this is what we mean. We mean it's that intellectual, behavioral, and emotional commitment. So we need to engage people intellectually. We need to engage their minds. But our work also needs to engage them emotionally. It needs to engage their hearts. And it needs to lead to actionable behaviors. It needs to change something. And so what we've been trying to do at IHI over the last 12 months or so is create some kind of framework that might be useful for people as they try to tackle those kind of challenges that Trissa just outlined for us, as they try and make progress towards tackling burnout and perhaps even achieving joy. And as we've been creating that framework, we've been paying some attention to the experience of healthcare organizations, and we've talked to many staff, leaders across the country and indeed internationally. But we've also been examining the evidence from beyond healthcare, from the social sciences. How will we know that we've seen joy? Well, we would start to see these things expressed in our workplace. We'd start to see expressions of gratitude. We'd start to see hope replacing feelings of hopelessness and how am I ever going to cope with this? We'd start to see approaches that were based on assets, not on deficits. We'd start to see assumptions about abundance, about us having the necessary tools that we need to make the progress that we need to make. And we'd start to get back to the real roots of why, my guess is, everybody in this audience came into the work that they do, whether it's in communities or clinics or hospitals, and that is to serve others. We'd start to draw on that strength and mobilize that asset. I think part of the challenge is that it seems like such a difficult path. There seems to be a chasm between burnout and joy. And we are very deliberate about talking about joy. We think that tackling burnout is necessary, but not sufficient. We really do want to create joy, but it's a tough path. But what might it look like? And I think one of the things that struck me from the comments that people were making as Trissa and I came into the room was that people were recognizing that this is it's a journey. And it's a journey that's built from the point of care. It's probably not a journey that's built from the boardroom. It's a journey that starts at the point of service. And folks like Aaron Antonovsky have been thinking about these kinds of issues in actually very difficult circumstances for many years. So a lot of Antonovsky's work was with Holocaust survivors. And he was asking why, in those circumstances of extreme stress, why is it that people still not just survive, but thrive? And his theory was that it's at least a part of it's a mindset. It's about thinking about health as more than the absence of disease, and that's why we want to think about burnout as more than about joy as more than the absence of burnout. But it's also about this sense of coherence. And what Antonovsky is saying is that the people who really thrived were able to do these three things. They were able to make sense of all of this. It was comprehensible to them. That they could see that they had what it took to make progress. This seemed manageable to them. I can see my way through this. I can figure out how to make progress. And then there was this idea that it was meaningful. It was really, it did engage them emotionally. And I think what Antonovsky is telling us is that whatever our framework looks like, it needs to be simple, manageable, and meaningful for people. People need to be able to see that they can make progress along this path. And so we had that in our mind as we were creating this thing. We also had in our mind Deming's advice that joy is probably a system property. And we need to design it into our work. So we need to create a system, something that is more than the sum of its parts. And then most of you have probably seen Maslow's hierarchy of needs, and this suggested to us that there might be some steps on the route from burnout to joy, that perhaps the chasm could be crossed in a number of steps that might start with safety and people feeling safe, and then move on to thinking about working as part of a team, which again was a theme that came up as we spoke to people as we entered the room, that then might lead to achieving your full potential. And Trissa will sketch out how some of this might apply in healthcare just in a moment. And so those were the things that were in our mind as we were creating this framework, and we were talking to people in our IHI Leadership Alliance about what joy in work meant for them. We were thinking about creating something that was simple, that had a system property, and that was perhaps in a number of steps in order to make it manageable. And so this is what's emerging. This is not a finished article by any means. We're just sharing this with you as where our thinking is taking us. And if people have commentary on this or about anything that Trissa and I say over the coming 40 minutes or so, please give us your comments, because we're not pretending this is a finished article. But we think that there might be these 4 component parts to a framework that might take us towards joy. But something that starts with asking, as we did when we entered the room, what matters to you? Finding out what's really important to the people who are in our teams. Then understanding really deeply the local context. You know, what are the impediments to joy locally? And they will look very different from environment to environment. They'll look different in one clinic as compared with another clinic. They'll look different in a community as compared to a hospital. But we really need to listen to understand what are those unique impediments locally in our context. The third piece is about creating a new organizational culture that has at its core a commitment to joy in work. And then the fourth is some actionable behaviors, some real pragmatic changes, evidence-based, that we think can make a difference. And so that's been our thinking as we created this framework. And I'm going to get Trissa now, not least because I'm losing my voice and need a drink of water, but I'm going to get Trissa now to start us by talking about the first of those steps, which is asking what matters to you. Trissa. Yes.
I really wasn't sure that I could do that.
Yeah, I was confident.
I'm pretty impressed with myself. All right, so to start off, we have to start where we always start, which is with assessment. And so we want to start by asking what matters, just like when we came in. And one of the reasons that we picked what matters to you is because of the successes that we've seen when we use that with patients in healthcare. And so just like our colleagues in the Imperial College in London, when they ask patients what matters to you, it helps us shift our mindset, and so that we engage both our minds and our hearts when we listen to hear what people say matters to them. So whether we're talking to patients or talking to our employees or colleagues in the workplace, we think this could be a valuable approach. And when we ask what matters, we have to be sure that we're listening, that we truly listen, not just to validate our assumptions and not just to empathize, but we want to listen both for barriers that people face and for the assets that they bring. And we want to listen to try to find the places where we can work together to make things better. So once we've assessed and we've asked what matters, we need to go a little bit deeper to really understand some of the impediments to joy, which again can vary by context. So here's some of the things that you might find. Some barriers to joy might include concerns about your physical safety. We know that healthcare workers, particularly nurses, have very high rates of acute and chronic musculoskeletal injuries, high exposures to blood-borne pathogens and other infections. And across the nation, we're seeing increased incidences of unnecessary and unfortunate gun violence. So are any of these physical threats an issue in your environment? When somebody leaves at the end of their shift and it's dark and they're walking to their car, do they feel safe? And do they feel like adequate precautions have been taken to protect them? Psychological safety. Do people feel safe to ask questions, to speak up, to admit that they've made a mistake? Are people safe from bullying or harassment? We'd like to think that that doesn't happen in healthcare settings, but I know some of us have witnessed that. Equity. Do people feel that their work environment is fair and just? And that could be anything from pay, equal pay, to promotions, but also just feeling like their voice is heard as much as the person next to them. Camaraderie. Do people feel like they're part of a team, part of something bigger? Do people feel like they have some choice in how they execute on their daily responsibilities? And ultimately, do people have meaning in their work? Do they feel connected to that higher purpose? So as Derek pointed out, the relationship to Maslow's hierarchy of needs, others have plotted these against that hierarchy. And what this reminds us is that the things at that base of the pyramid, sometimes that represents first things first. And so if we don't first attend to things like physical and psychological safety, we may not be able to help people get to connection to meaning. So I want to take a minute and dive a little bit deeper into the intersection of psychological safety, equity, and camaraderie. Because I'm afraid that there's some issues that if we don't tackle them head on, they could represent significant impediments to joy. And what I'm talking about right now is within medicine, our culture of power and privilege. So Don Berwick, in his plenary right here in December, and then summarized in this JAMA article, talked about 3 eras of medicine. The third era is the one that we're launching into now going forward. But the first era was hundreds of years ago, and it had to do with the ascendancy of our profession, when doctors rose to status of the elite. And I think from that is where we find this legacy of power and privilege. Now, this may seem like an old-fashioned notion, but I want to give you a few examples, perhaps, of how it's played out. So first, I want to tell you a story of when I was a medical student. Okay, way back when I was a medical student. Just travel with me for a few minutes. So I was on my surgery rotation, and we were doing morning rounds, and we were rounding on the patients that we were going to do surgery on that day. And we went into this gentleman's room. And so we went in there, the attending physician, the chief resident, a couple of other residents, several medical students, including myself. And we crowded around his bed and began to talk over him as if he wasn't there, as was the general practice at the time. And the attending asked us all many, many questions. What procedure are we doing today? What are the risks that might be involved here? What are his labs? What can we do about that? What are the medications that he's on? What was the differential diagnosis? All kinds of things that we're talking about in very technical language. And I remember looking at the patient's face throughout this whole conversation and worrying that he seemed to be getting more and more afraid. And at some point, the attending did turn to the patient and say, how's it going today? And in my recollection, the patient squeaked out, fine. And at that point, the team proceeded to leave the room. So I chose to hang back for a few minutes. And I went over to the patient and I said, "Sir, are you okay?" And he turned to me and he said, "Did they just say I'm going to die?" And I was like, "No, of course not. They definitely did not say you're going to die. And in fact, I think if they thought you were going to die, they wouldn't take you to surgery today." I said, "Would you like me to have someone come back and talk with you and answer your questions and help you understand what to expect today?" He said, "Oh, please, thank you so much." And so I turned to leave the room, and as I stepped out of the room, I could hear my chief resident bellow at me from down the hall, "Hey, Torres, get over here. We need those charts." Now, I don't know if any of the rest of you remember this, but do you remember when we had those hard copy charts and the 3-ring binders, and we had them all on a cart, and we had to push the cart down the hall? So as a medical student, that was my job. So clearly, I was neglecting my job. But so, what message was that sending me as a medical student? That my only contribution was to push the charts? They were actively discouraging me from attending to the emotional needs of our patient? And what message were we sending the patient? That their concerns don't matter, that we're all powerful and they're at our mercy, I don't think that's okay. Now, we might say that was years and years ago, but I want to give you one more example just from a few months ago. And in this scenario, I was a family member. So I went with my 22-year-old daughter to a follow-up appointment after hospitalization, and she was pretty medicated, so I had helped her write down all of her questions. So we went into the visit, and the physician came in and immediately launched into the explanation of the treatment plan and what was going to happen and how that was going to roll out over the next several weeks. And the doctor seemed to have a lot to say. And I could see my daughter getting a little bit uncomfortable. And so at one point, I interrupted the physician and I said, excuse me, we have some questions that we would like to ask. And the doctor said, you just need to wait till I'm done, and then you can ask your questions. So we waited, and the doctor continued on her monologue, and then got up to leave the room. And I said, excuse me, doctor, we never got our questions answered. And she said, I'm sorry, time is up, I have another patient. And she left. Needless to say, I was furious. And my daughter was upset and confused. And I would venture to say that that clinician was probably not feeling particularly good about that interaction either. I think that clinician, that physician felt harassed by us. She felt rushed and concerned about the next patient. My guess is that she would rate herself pretty high on that burnout scale. So what would it look like if we could change the experience for that clinician or that medical student? So instead of them feeling pressured and rushed and not valued, we could turn that around so that they could feel connection and teamwork and purpose. I think that could take us a long way. When we think about those two examples, 25 years apart, I think they have some things in common. And I think they show behaviors and evidence of a culture that is our legacy from hundreds of years ago. And that's that legacy of power and privilege. So one of the things that I worry about when we think about that legacy in medicine of power and privilege, I worry about what happens when we layer on other issues in our society of power imbalance, like around gender or race. And I wonder, in our work environment, in your work environment, how much does implicit bias or institutionalized racism impair joy for people in your workplace? And I'm not sure that we know. So I did find this one survey of medical students done several years back to ask them about their experience of discrimination and prejudice in their training. And both minority and white students had a lot to say about that. But I'm still not sure that we know how big of a problem this is. So our colleagues in the National Health Service in England went about measuring this within their environment. And they gave a survey to their employees across multiple settings. And what you can see here is a list of many, many different settings across the National Health Service in England. And they asked about experience of discrimination within their work setting. And they found significant disparities between the experience of the white employees and the black minority ethnic employees. Big variation by setting, but present in almost every setting, and big discrepancy between the experience of whites and the experience of black minority ethnic staff. And they went farther to show that the sites that had the highest rates of the experience of discrimination against minorities had the lowest patient satisfaction rates. So immediately, that becomes a business imperative to address racism in the workplace. And so our colleague, Yvonne Coghill, is now the director and champion for the Workforce Race Equality Standard, where they have set standards and they're going to measure against them and they've implemented multiple quality improvement initiatives to target these issues directly. So how much of a problem is this in your setting? I think that we have to ask, we have to listen, and then we have to dive deeper to understand. So once we ask what matters, we listen, and then we work to really understand the impediments to joy in our unique workplaces, then we need to go the next step. So Derek, where would we go next? Oh, wait.
2 out of 2 on a hat trick. So as Trissa said, by the time we get to this stage, and this is important, I think, that we've asked multiple staff members what matters to you. We've understood what would bring them joy in work. And we've started to figure out what those contextually sensitive impediments to joy might be. And that needs to be done to inform this third step, which is really about how do we shift the culture in our organizations? How do we create a climate and an environment where people can thrive? How do we create that at all levels of the organization? There's work for everyone to do as we strive towards joy in work. And we think there are at least 3 components to this. There's something that's about constancy of purpose, of how dispiriting is it? And I think we've all been in these environments sometimes. I know I have. Sometimes I've even been responsible for this. But how dispiriting is it for the organization to kind of zigzag across, well, this is important today. No, it's really this that's important. Well, forget what we said last year. This is our new. Folks need constancy of purpose, and it needs to mean something to them. Then there's something I think about consistency of values. Values are important in healthcare. I can't think of an industry where it's more important, and values are important in our communities. And then there's this idea of shared leadership, that this is everybody's responsibility. I want to focus mainly on the constancy of purpose piece, and we're trading Don Berwick quotes here.
Thanks, Don.
Guess there are worse people to quote. But Don said in this seminal article that he wrote for the Journal of General Practice in the UK, he wrote that the source of energy at work is not in control. It is in connection to purpose. And I think Don was signalling there a shift in culture from top down to something that was line of sight from the point of care. Part of achieving that constancy of purpose, I think, lies in reminding ourselves constantly of why we're here, of the humanity of our work, of the importance of what we do to people in our communities and clinics. Some of it lies in building trusting relationships. Without trust, there can be no joy. And some of it is about staying true to those values and not walking past, and I'll explain what I mean by that just in a moment. But firstly, that human face behind every statistic. I can't remember who it was, but someone once said that statistics are people with the tears wiped away. And I think that's right, and it's constantly important that we remind ourselves of that. And our friends and colleagues at Wellstar, I think, do this really well. So they collect data in the way that we folks experienced in quality improvement would expect to see it collected. You can see here their records of their serious adverse event rates and their progress that they're making and what they're doing to train their staff. This is the same data. Reminding us of every individual behind every dot. Which is the more engaging? Which is the one that connects us to purpose? And then this idea of trust, there's folks may have read this book by Patrick Lencioni called The 5 Dysfunctions of Team. But what Lencioni is telling us in that fable of an organization is that if we are serious about focusing on achieving a group goal, then we better pay some attention to trust. Because without that foundation of trust, what you get is concealment, you get siloed working, you get territorialism. I'm just going to focus on doing my bit, and I don't, whatever goes on over there in the organization, I'm not really accountable for that. I'm not going to pay any attention to it. But if we can get trust in this new culture that will support joy, then I think we'll make a huge step forward. And then the third piece of this, I think, is that bit about don't walk past. And I want you to just listen to the messages that are shared with us here by General Morrison from the Australian Army, and then I'll come back and say what resonated with me from listening to the General.
Earlier today, I addressed the media, and through them the Australian public, about ongoing investigations into a group of officers and NCOs whose conduct, if proven, has not only brought the Australian Army into disrepute, but has let down every one of you and all of those whose past service has won the respect of our nation. There are limits to how much I can tell you because the investigations into this network by both the New South Wales Police and the ADF Investigative Service are ongoing. But evidence collected to date has identified a group of men within our ranks who have allegedly produced highly inappropriate material, demeaning women, and distributed it across the internet and Defence's email networks. If this is true, then the actions of these members are in direct contravention to every value the Australian Army stands for. By now, I assume you know my attitude to this type of conduct. I have stated categorically many times that the Army has to be an inclusive organisation in which every soldier, man and woman, is able to reach their full potential and is encouraged to do so. Those who think that it is okay to behave in a way that demeans or exploits their colleagues have no place in this Army. Our service has been engaged in continuous operations since 1999 and in its longest war ever in Afghanistan. On all operations, female soldiers and officers have proven themselves worthy of the best traditions of the Australian Army. They are vital to us maintaining our capability now and into the future. If that does not suit you, then get out. You may find another employer where your attitude and behaviour is acceptable, but I doubt it. The same goes for those who think that toughness is built on humiliating others. Every one of us is responsible for the culture and reputation of our Army and the environment in which we work. If you become aware of any individual degrading another, then show moral courage and take a stand against it. No one has ever explained to me how the exploitation or degradation of others enhances capability or honours the traditions of the Australian Army. I will be ruthless in ridding the Army of people who cannot live up to its values, and I need every one of you to support me in achieving this. The standard you walk past is the standard you accept. That goes for all of us, but especially those who by their rank have a leadership role. If we are a great national institution, if we care about the legacy left to us by those who have served before us, if we care about the legacy we leave to those who, in turn, will protect and secure Australia, then it is up to us to make a difference. If you're not up to it, find something else to do with your life. There is no place for you amongst this band of brothers and sisters.
It's powerful stuff, isn't it? And I've seen that many times now, and we discussed it in our Leadership Alliance when we talked about this idea of joy in work. And a few thoughts always stick with me when I watch it. Firstly, when he talks about no one has ever explained to me why degrading or exploiting others leads to better outcomes. And it's a it's a step, but it's a relatively short step from Torres, where's my charts, to the humiliating behavior that the general is calling out. The second thing he says is this is everybody's responsibility. It's a particular responsibility for leaders, but this is everybody's responsibility. Have the moral courage. And we all need to have the moral courage. If we're really going to tackle burnout, if we're really going to promote and grow and nurture joy in work, then we all need to have the moral courage to call it out. It's easier for some than for others, I accept that, but we all need to take that moral courage. And passionately, the general says, the standard you walk past is the standard you accept. So let's not walk past. Let's address these issues together, all of us. And once we've got to understanding what matters and deep conversations about the impediments, and then figuring out how we're going to use that intelligence to really change our culture, then there's a final step of our framework, which is just let's do some stuff. Let's action some of what we've learned. And there are many, many validated approaches that you can use once you've started to understand the motivators, the facilitators, the impediments, and the cultural change you want to make. I suspect some of them might be in relation to empathy. Because just as there's a strong evidence base that empathy in our care can improve outcomes, likewise, why would it be any different in our relationships with our colleagues? Don't we believe that if we demonstrated empathy towards our colleagues, we would create that kind of joyful environment? And so let's stop perspective taking that's damaging to people, and let's start to build understanding. Let's stay out of judgment and listen to understand, not to judge. Let's recognize how people are feeling and remember that every member of staff in our organization has a life outside their work. And they're people, not just staff members. And let's communicate. Let's have a conversation about this. And this is going to require some changes for leaders. If we're serious about joy in work, then I suspect that the leadership that's required here isn't going to be heroic leadership. It's going to be humble leadership that's really grounded in an ability, as Edgar Schein says in this book, to pursue the gentle art of asking, not telling. The route to joy in work is unlikely to come in a glossy culture change document laminated for effect. And it's much more likely to come from leaders helping others along the path, reaching out to ask what matters to you. And there are some green shoots. There are some organizations who are really making some progress with this, really taking it seriously. This is just one of the stories we heard in our Leadership Alliance. This comes from Health Partners. And the thing I really like about this, a couple of things actually, but the first thing is it's all-encompassing. It recognizes the complexity of this. It recognizes that there might be financial issues and issues around people's physical well-being, but also issues about what's going on in their community. And so it's trying to recognize the complexity of improving joy in work, but at the same time with a relatively simple goal. And then it's underpinned by a philosophy that's aligned with what the organization is trying to achieve, that's integrated with the cultural change that's trying to make, that's visible to the whole of the staff, and that's trying to leverage the expertise right across the whole organization. And there are examples now starting to emerge of organizations who are really tackling this issue. And we should steal with pride. We should find those examples and understand how they might apply in our organization. And we are trying to do that in IHI too. So we believe that if IHI is going to be credible in working in joy in work, we need to walk that particular talk. This is at the table beside those lifts, elevators, that are at the entryway to our building. Just a simple way of taking a daily measure of joy in work. So what we ask staff to do is, as they're leaving the building in the evening, they take a blue pebble if they've had a day where they've made progress, and they drop it into the bucket. And they take a sand-coloured pebble if they've had setbacks on that day, and they drop it into the bucket. And we look at the bucket every day to get some sense of what's the temperature of the organisation. And then we've now started more regular measurement of our pulse in the organisation. We call this our pulse survey. So rather than waiting for a year to get our annual whole staff survey, which we still do, every 2 months we issue a simple 6-question questionnaire to all of our staff. We get over 90% completion rates, and you can see some of the progress that we're starting to make since we began to work on this. Back in May of last year, something like, 81% of staff thought that IHI either agreed or strongly agreed that IHI was an excellent place to work. Now we're up to 97%. Because we've been applying this science of improvement. We've been doing simple quality improvement to act on this data. We've been trying new things. We've been learning what works and what doesn't work. We've been working on things that really matter to our staff, like equity, as Trissa mentioned. We've been building the will for change, we've been generating ideas, and then we've had some evidence-based approaches to implementation. We've just been doing simple quality improvement. And we've still got a way to go. You can see we're more challenged by this measure, which is about whether IHI is going in the right direction, but we're still making progress. And actually, it's probably okay that some of our staff at IHI don't think we're going in the right direction. That's where creativity will come from. That's where new ideas will come from. That's where we can listen to every voice to find out why this is the case. So some simple things we can do, some validated approaches that we can take. And here's another of those validated approaches that we've used. So we've adapted this somewhat. We start every Monday morning with our senior team meeting, our priorities group, we call it. Trissa and I are there. And the first thing on our agenda every Monday morning is one good thing. And we don't ask people to figure out 3 good things that happen, just one good thing. But it helps to just kind of generate some feeling of joy, because people talk about something good that happened over the weekend. I've found out about this from Brian Sexton at Duke University, but it's originally from Marty Seligman. And Brian and his colleagues are getting very close now to randomized control trial evidence that shows the efficacy of this approach. And all it takes is to write down every evening 3 good things. The act of writing it down seems to be important. 3 things that went well today. And then you do that for, when you start, for at least 2 weeks. They ask you to do it for 2 weeks, but you start to see signs of progress after 4 to 5 days of writing this down. But if you do it for 2 weeks, it tends to have effects that last for a year. Just by writing down 3 good things. And those clinical trials are starting to demonstrate benefits around lower stress levels, better work-life balance, people get more sleep, and they feel more engaged. Simple things that we can all start to do today, tomorrow. Write down 3 good things. So here's a summary from me about what I think is key here.
And I'm going to interrupt for a second, because one of the things you need to know about Derek is he thinks in threes. So here's his 3 things.
Yeah, thanks, Trissa.
Yeah, no worries.
But it's true. If you look back on those slides, those of you who have downloaded them, you'll see that most of my slides have 3 things on them. I'm a simple soul. But here's my 3 takeaways. Thank you, Trissa, again. This is not a project. I don't know about you guys, but I have never come across a cultural change program that really worked. A project. This is not a project. This is the way we work. This is our whole culture and ethos and being and sense of who we are. We need to bring all of that to joy in work, not just good project management. Then there seems to me to be these 3 C's that are really important. One is around coherence, the making sense of all of this. Antonovsky's stuff about simple and manageable and meaningful. There's something about consistency, about sticking with this when times get tough, and really committing to pursuing joy in work. And there seems to be something to me about this connection to purpose. That's our big advantage. Actually, the world of health and well-being in improving quality in healthcare and improving outcomes for our communities, we should have a big head start when it comes to burnout, because we can connect to purpose. So let's do that. And then my 3rd takeaway is just to start. This is going to be tricky. It will be a bit muddy out there. But let's just start to work on joy. Trissa, what would you add?
I would just add one thing, and that's take care of yourselves. We know that we can't take care of anybody else unless we take care of ourselves first. So use this opportunity over the next couple of days, refocus on what matters to you, make some connections, and reconnect to your purpose. Most importantly, go find your joy. Thanks, everyone.